Come in.
Hello, I'm Naomi. I'm here for an interview.
Hi, Naomi. Nice to meet you.
Nice to meet you too.
Have a seat.
Thank you.
Thank you for coming to the interview.
No, thank you for taking the time to meet with me. Here's my resume.
Thank you for your resume. I'm just going to ask you some questions now about your experience and get to know you a little better. Okay, so to start, tell me about yourself.
I recently graduated from the Trent University BSCN program. I passed my NCLEX 2 months ago, and since then I have worked in a long-term care home and I have been eager to start my nursing career in an acute care hospital. While in school, I had a placement on a cardiology unit, and my last two placements were at an oncology inpatient unit at Brampton Civic Hospital and Trillium Health Center. From these clinical experiences, I have gained a keen interest in working with oncology patients. These placements have taught me how to communicate effectively and provide therapeutic care to these patients with distressing diagnoses, which has been rewarding for me. Working in oncology also relates to me personally, as I've had many family members who have been diagnosed with cancer, and I feel that these personal experiences have shaped me to better provide care that is compassionate and empathetic.
That's good. So, why do you think you would be the best fit for this position on the unit?
Based on the hospital's values of compassion, professionalism, and respect, I feel that they resonate with my personal values as a nurse. I also know that the vision statement here at Humber River Hospital is exceptional care, healthier community, which I appreciate because I always strive to do my best in providing quality, holistic care to improve health outcomes for the community. As such, my passion for caring for vulnerable individuals with cancer diagnoses will always be reflected in the care that I provide.
Great. I like how you did your research on the hospital and mentioned the values, which is very important to all the staff members that are working here. Now, where do you see yourself in 5 years?
Well, I'm very interested in honing my skills as a nurse throughout these years as I'm starting off as a new grad. I also want to further my education and competencies by taking extra courses such as the D'Souza Chemo Certification course. Lastly, I am also interested in a mentorship role, so definitely taking on a preceptor position for future nurses, as I love to teach as much as I love to learn, is something that I want to try out in the future.
Excellent. We have a lot of opportunities for learning as well as mentoring that we can provide for our nurses, so that's something we can offer you. Would you call yourself a team player?
Yes, I am a team player, yet I also work well independently. I really enjoy working with other people as I am empowered to work diligently by being collaborative, engaging in teamwork, and helping others. As an example, I offered to take turns with another student during my group clinical placement with giving bed baths to our total care patients to alleviate some of the workload that would have been more difficult if we worked individually.
I like that. Teamwork is very important for nurses because this career can be difficult at times to manage alone. Speaking of difficult, how do you deal with the stress of nursing?
In the moment, I try my best to keep my composure and present myself in a professional manner to patients and other staff. No matter how stressful the situation is, my main focus are the patient's needs. After the stressful situation has passed, I engage in self-care strategies such as exercising regularly, eating healthy, nutritious foods, and ensuring that I get enough sleep so that I am well rested to go to work. I also think that self-reflection is very important as it helps me to recognize what I need to improve on for future situations.
I'm glad that you found ways to deal with stress that works for you. Now I will be asking you some behavioral based questions that you can answer based on your experience. So tell me about a time you effectively educated a patient or their family.
A time where I effectively educated a patient and their family was when I had a patient that was told that they had a poor prognosis and to think about the next steps. In this case, I provided the patient and family with the appropriate resources for support and information about what to expect in the next phase of their care journey. The patient and their family really appreciated how informative I was, which benefited them in adjusting to the end of life process. In the end, they chose hospice care, which helped them be in a comfortable environment where the patient felt safe and respected before they died.
That's a good story. Now tell me about a time you showed leadership in your practice.
A time where I demonstrated leadership in my practice was when one of my colleagues was unfamiliar with doing a G-tube feed, and I took the initiative to step in and teach them, as I have experience in long-term care with performing this skill.
Great. Now tell me about a time you spotted upcoming problems in a patient and what did you do?
There was a time that I noticed that a patient was alert and oriented at the beginning of the shift, yet by lunchtime I noticed that the patient's level of consciousness was decreasing. I took the patient's vital signs and did my assessments and noted that the patient was desaturating, bilateral crackles were auscultated, and the patient was having difficulty breathing. I gave the patient oxygen, elevated the head of the bed, and immediately called for help. I informed the primary nurse, which was my preceptor, as well as the doctor and the charge nurse.
Okay, now describe a time when you didn't know how to deal with a healthcare issue that arose.
During one of my clinical placements, the physician had ordered a blood transfusion for one of the patients that I was caring for. In this situation, I was not aware of the hospital's specific protocols related to blood transfusions. In this case, I informed my preceptor and also asked the resource nurse, and they were able to show me where to find the hospital's policy and procedure manual. In situations like these, I would not be afraid to ask for help, as I would rather seek clarification than put a patient at risk.
Now tell me about a time you had a conflict with a colleague and how did you handle it?
As a student, my preceptor drew up insulin for me and then asked me to administer it to the patient. I did not feel comfortable doing so, as I did not see her draw up the insulin myself. She became upset with me for refusing to give this medication. However, I apologized and respectfully told her that it was because this goes against the College of Nurses' professional practice standards, and I am accountable for the decisions that I make in my practice. After explaining this to her, she understood and administered the medication herself.
I'm glad you were able to advocate for yourself in that situation. You did the right thing. This concludes the interview. Thank you so much for your time. Do you have any questions for me?
Yeah, actually, I have a couple of questions for you. What is the nurse-to-patient ratio on this unit?
Good question. During the day shift, nurses take on about 4 to 5 patients, and at night, nurses have 6 patients.
Okay, great. And also, what are the development opportunities that this hospital provides?
We have paid education days where nurses come in to refresh their skills. We also have educational projects and mentorship programs where you can take part in a team of colleagues that enforce best practice guidelines and evidence-based research.
That's awesome. Like I said, I love learning and anything that helps with improving my knowledge and skills as a nurse. Being a novice nurse, I feel like everything is still fresh and this is only the beginning of my career. I am excited to develop all my skills and become an expert in caring for oncology patients as a healthcare provider. When should I expect to hear back from you?
Probably next week after all the interviews have finished and we've come to the decision. We will get in contact with you once we make a job offer.
Okay, great. I look forward to hearing back from you. May I please have your business card with your contact information so that I can contact you if I have any further questions about the position?
Yes, my business cards are in my office, so I will give you one on the way out.
Perfect. Thank you so much for taking the time to meet with me and learning about my experiences.
No problem. It was a pleasure to meet you too.
Have a good day. Take care.
Thanks. You too.